Mother. Hey. Okay. I was trying to reconnect and I almost said a cuss word. So, all right. Glad you guys could join us for the show tonight. I want to welcome you guys to the Dr. G Show. I really appreciate you guys being a part of this. This is like episode 75 or something like that. And, this is kind of a free service of trying to get people engaged with thinking about different ways about how to fix things. So tonight we're going to do something a little bit different. Our topic today is called a month, and this is for the rest of the month. So a month's worth of miracle patients. And many people have a little bit of idea of what I do, but they don't know all these kind of stories of all these different miracle patients, all these people that were untreatable that are suddenly better, help people get their lives completely back in order. And so as I talk to people, like when we're at a martini bar or when I'm with friends at a conference or something, everybody's really amazed. And even when I talked to them at the research department up at KU, they were like, "Oh, you got to publish this stuff." And so to me, it's very like, I don't know, I'm used to it now. I'm not excited about all the miracles because I expect it to happen. I only get excited when something doesn't work right, and then I got to really spend some time researching. But it's important because all these patients that get better, that were told they couldn't get better, they become that light of hope for all the other patients around, or all the other people around the world that were told they can't get better. And that's the coolest thing. So like when a Crohn's patient is no longer Crohn's, or when a type 2 diabetic patient is no longer type 2 diabetic, it's amazing, but they truly become that inspiration for others because they are constantly told there is no way to fix those problems. And now they become that living example. Hey, Valerie. And please, as you join, feel free to post questions as we go through this. I have a somewhat set agenda. I usually play it kind of loose and fast. But if you post stuff, let me know. And I'll try to keep up with you guys. If I don't, just know that I will answer all these questions offline too. A lot of times, I think we had a couple of weeks ago, we had like 1,000 views and I don't know, 157 questions to start off with. So it took a little bit to get through that. So welcome to the show. Thank you guys for joining. Please share this. Please like it. It's really nice to have other people get involved. I love how many people comment through this and really kind of share this information. And it's I run into patients all the time, or run into people every now and then that their lives are changed, and so it's kind of exciting to hear kind of where they went after they felt better, and they kind of just fall off the map a little bit, and you don't know what happened, and then suddenly they can work again, they can do all these things they couldn't. Now, I do want to address a few things. So, where's Holly, right? Where's Holly at? I know Dan, he Facebooked me, and then a couple other people have Facebooked me over the last couple times, like, where's Holly? So everybody loves Holly. Holly's so awesome. But Holly took a job, and she's the corporate wellness director at the YMCA. And so basically we had the summer off, and so we might try to get Holly back in and as co-host, and she did awesome, and everybody loved her. And she's the only one that didn't take my crap, so she did a lot of eye rolling and glares. So, plus she's an awesome host. So, all right. So I want to do something a little different. So I want to do a little kind of information in the beginning. A lot of people, you know what I do. The ones that have seen me before, but what we do as we go through and talk about these miracle cases is to understand why it's different. There was this great slogan that I heard a long time ago, and it says, most patients are chronically suffering and dying prematurely based on what their current doctor doesn't know. And that's amazing to me. And I really figured that out when I did the Harvard Medical School's lifestyle medicine program. And so all through this continuing education program and competency courses, you really figured out very quickly that holy crap, there is two widely diverse educations given, even at the same Ivy League institution. So at Harvard, like say Crohn's. Crohn's is a really good example. This is one that really blew my mind. The typical Crohn's program that I went to, it's the patient has Crohn's. What meds are we going to give them? All right, well, we'll give them this med, this med, and this med. Usually steroids and pain meds. And ways to shut off their immune system, so MIBs. And patient's not tolerating this medicine, so we'll change this medicine, lower this medicine, add this medicine. And then patients, not responding to this medicine, so we'll add this medicine, we'll change this medicine. And that's all we really did was basically med management and trying to figure out how to solve the side effects and the nutrient depletions from those and still manage those symptoms, but just chronically manage those symptoms. And then eventually refer out for surgery. Really just cut out the valve, they poop out of the bag, and patient's solved, right? When I did surgery rounds in med school, and that's all we did was just chop stuff out. You complain about it, we'll chop it out and it'll be fine, right? But we weren't solving any problems. And so at Harvard, it was the same thing I was used to already, which is just chronic management. But they also have these lifestyle medicine modules. And the lifestyle medicine one was really what changed my aspects to all this. It changed how I clinically practice. And it made the biggest difference ever to solving some of the most chronic problems with patients. So all these patients that went to the Mayo Clinic, they've been to every expert in the world, and suddenly they're seeing this guy in Kansas with this little office, and just, why were we able to fix them? And it was just because of all the research and all the knowledge that I have, that I've gathered over the years, and how clinically different we think about patients and conditions. So Harvard offered this lifestyle medicine program, and Yale did too, but Yale's lifestyle medicine program wasn't all that unique necessarily, right? But I took Crohn's course through the lifestyle medicine, and it was greatly different. It was patient has Crohn's, what are they doing to cause it? And that blew my mind, right? This is the first course I ever took that was like, what are they doing to cause it? All the natural medicine courses I ever took, all the clinical nutrition courses I ever took, it was how do we manage the same condition with naturally occurring medications or supplements instead of the synthetic medications. And I didn't like that. It's the body's designed to heal itself given the right opportunities. Why the hell are we not solving any problems, right? Well, all we did was naturally chronically manage people, and I didn't like that. I didn't like it at all. If it's designed to heal, what the hell are we doing wrong? So with that Crohn's course, it was amazing because it was like, okay, well, let's make these lifestyle changes. Let's make these dietary changes. And then it was patients 50% better. All right, well, let's make these changes and these changes. Now patient's 85% better. All right, well, let's make these final lifestyle changes, and suddenly patient is cured. The uncurable was cured. But you could have two doctors then that both went to Harvard Medical School for the continuing education modules. They both took the course Crohn's, but one took it through the lifestyle medicine program and one took it through the regular program, and those patients would get completely dipolar solutions. One person's going to get a bunch of meds and then the surgery. The other person gets to live a normal life. Isn't that crazy? That's so crazy to me. That literally the difference is what course did your doctor take. So that's what I dedicated my life to. That's why I have plaques all over the wall. Is because I want to know 10 different ways to fix every single problem. And because of that, and because of changing the idea of how to practice, not management, not natural management, but how do we create these problems, suddenly we had all these crazy miracle patients. And I want to share those over the course of the next 5 weeks. So tonight we'll have that little introduction, and then we'll talk about some cases. But over the next 4 weeks, I want to talk about more and more of those cases because they are so just fascinating to me. Like, I love it because it involves research and fixing the things, and I love fixing things, you know. But what's amazing is these were the, you know, you kind of get that mindset like, well, these people have seen every expert. What the hell am I going to do? But they didn't do what I did. They didn't talk about how we fix it. So what we do, or the idea of how to address these things differently, is to do what's called functional lifestyle medicine. So it's kind of a mix of clinical nutrition, functional medicine, integrative medicine, lifestyle medicine, and really just figuring out what are they doing to cause it and stop causing it, right? That's the easiest way to fix all the problems. I'll give you an example. Is back in the 70s, we had a gas shortage. So the solution was for the gas station to make a little bit more money was water down the gas. Then when you put watered down gas into a gas combustion engine, suddenly it didn't work very well. Lots of knocking, lots of pinging. So the solution was keep selling the watered down gas, but now buy a solution that you can get at the AutoZone that will dehydrate or take that water out, so the engine will try to run more normal. So they put in the watered down gas that shouldn't be in there. They buy this product, and they keep doing that until they meet a guy like me. And all I say is, stop putting watered down gas in your engine because it shouldn't be there. And when the engine starts working normally, it's not a miracle. It's how it's designed to work. So the human body is the same way. So if you take something very simple like chronic fatigue, fibromyalgia, right? They became diseases in 1984. They became epidemics almost instantly. But it was only 4 years after we took aspartame from petroleum waste products and created a fake sugar to create Diet Coke became the #1 selling soda, right? So when we took petroleum, which is sweet, and made a sweetener out of it, which is from formaldehyde, and at 87 degrees those aspartames convert back to formaldehyde, we started feeding a population of formaldehyde. And when they had these chronic fatigues and fibromyalgias, these new diseases, that's what should happen. And so it's not a disease, right? All diseases are not diseases. They are the normal expected outcomes from doing what we do. If you drink formaldehyde, your immune system should suck, and it should autoimmune and attack you, right? That's not unexpected. It's not genetics. It's not some mystery. That's exactly what should happen. And so the same thing we apply with things like, let's say, I love my favorite. If you go to McDonald's, which you shouldn't, and you get a strawberry shake, which you shouldn't, because dairy's the devil, and you drink that, what do you think? And some of you guys might know this, so post it. But what do you think makes it taste like a strawberry? So a strawberry shake, what makes it taste like a strawberry? And so, see if anybody can get this. But if you go to, so it's kind of a trick question because you think it's a strawberry, but it's not, right? But if you go to any other country in the world, and you go to the same McDonald's, and you get a strawberry shake in those countries, what makes it taste like a strawberry? We'll see how. I know there's always a little delay here when we ask questions. So think about that. What makes it taste like a strawberry in the U.S. and what makes it taste like a strawberry in the rest of the world? Yeah, Valerie's right. Not strawberries. Well, in the rest of the world, it's a strawberry. Same company, same drink, it's a strawberry that makes it taste like a strawberry. But not in America. So in America, I'll give the answer. There you go. So Jenny, right? That's right. Dan's right. They are artificial colors that are derived from coal tar, which is a waste product from petroleum manufacturing. Literally, yellow food coloring decreases your brain growth by 3,000%, blue by 5,000%, green by 8,000%. But those artificial colors and flavors that make it look like a strawberry shake, it's made from 44 different chemicals, most of which come from coal tar. So now you have a population drinking something that tastes like a strawberry that's just petroleum. So should we get sick? And if we chronically do these things, we should be chronically sick. So the solution, the way I practice, so that functional lifestyle medicine, is to identify those things, know all these things, and good Lord, it's a lot of information. But then stop doing it. Just stop doing it. And that's the most disturbing thing is when you figure out almost all the things that we eat, drink, breathe, rub on our skin, and wear in America is petroleum. And so we should be sick. We should be sick. So much of what I do is teach people how to be un-American, really. So stop causing the problem. Most things go away. So that, people often ask how I got to that point, and I had quite an educational journey. So in high school I tested into a medical magnet program. There's like 400 people that applied. 72 of us got in. 18 of us graduated, and 3 of us graduated early. And so two of them got picked up at Harvard, if I remember right, our junior year. So that was awesome. I wasn't one of them. I don't know. But all right. So then our junior and senior year, all we do in high school is we took 8 sciences and 5 maths, and I was super nerd, so I loved all this stuff. And then your junior, senior year, all you do is medical rounds. So I did pediatric rounds because I wanted to be a pediatrician. I only found out that that's not such a great thing because nobody's seeing you with happy children. They see you with sick children. And so when I was doing rounds at Cook's Children's Hospital in Fort Worth, I finally went to the oncology rounds for children. And oh my God, like kids died. Kids died. And I was just like, I don't want to be that doctor. I can't be around sick kids all the time and kids are hurting and pain. And like I was just like, did neonatal at John Peter Smith Hospital, which was the county hospital. And I did my rounds in the NICU unit and checking on the babies. And the one baby was sitting there just crying and blood was pouring down their face. And I was just like, what the hell nightmare is this? This is insane. And I was just like just shaken by that. And I went to the nurses station and told them, and they're like, yeah, they pull their IV out of their head. Like, they have it in their arm stuff, but they mess with it, so they put it in the head, and that kid pulled it out, and so blood was coming out. Good Lord, it was crazy. And so then I was like, well, I want to do something more natural that doesn't involve hurting people. So I chose chiropractic. But we didn't have chiropractic around. So I went to Texas College of Osteopathic Medicine and finished out my manipulative medicine rounds there. So I like that because we're all happy. Nobody's getting hurt. No bloody children. No kids dying. I thought, okay, I can do this, right? So then I went to chiropractic school, got my doctorate early. But I still felt like I couldn't help people the way I wanted to help. So then I started medical school, and I did like 3,500 hours of clinical rounds, and the only time we ever helped anybody was surgery, which was just chop stuff out. So it still wasn't to the place where I wanted to be with patients. And then towards the end I had pediatric rounds again, and it just killed me. It was devastating because it brought up all those same memories again. All we did was see these horribly sick children. All we did was just chronically manage them. And again, other people, great, that's your job, that you love it, that's great. I could not do that. And right about that time, I met a guy that did natural medicine. And I said, talked to him about medical school and how frustrating things were with not getting the clinical success that I thought we cured people, but we weren't curing anybody. And so he said, no, I help reverse diseases. I help, do this. And I was like, that's bull crap. I want to hear from your patients. So I took 2 weeks off of medical school rounds, and I actually went and followed him, and I talked to his patients. And suddenly, patients were actually better. They used to have heart disease, used to have cancer, used to have diabetes. They used to. And I was just like blown away because that's what I went to school for. 12 years of grad school, $160,000, $70,000 later. That's what I really wanted to do. So I decided to quit medical school about 6 months from graduating, and which is weird because I had another friend that he quit KU 6 months from graduating. But if it's not what you want to do, it's just not. I want to help people. I want to cure. I want to be able to fix people, right? And so I just started clinical practice then and started natural medicine. in natural medicine in the beginning. So I got a clinical, what is it? I got a diplomate or a postdoctoral diplomate from the American College of Clinical Nutrition, and then later I got one from the American Chiropractic Board of Clinical Nutrition. And so I had dual diplomates in clinical nutrition. But all I felt like we were doing initially was really chronically managing people. And so it was like, don't take those drugs, take this. But we're still not fixing, and I didn't like that. And very quickly I outgrew the practice that we were in because I wasn't comfortable with just managing. I didn't want to get rich and sell tons of supplements. I wanted to fix people. And so I started looking into functional medicine. So then I did functional medicine, got involved with the board, got a diplomate in functional medicine, and that was pretty cool. And so I tried to kind of mix the two. But it still wasn't quite what I wanted. It seemed like a very expensive way to figure stuff out, but it wasn't really how to fix and reverse as much as I really wanted. Now, again, there's lots of great functional medicine doctors. There's lots of great clinical nutrition doctors. Don't let me disparage that. But for my journey, then the next step was to figure out how to fix and really how to prevent, how to not have the disease. And I taught like 6 years of not memory. I taught 6 years of anatomy and physiology, and I taught microbiology, but mostly teaching I can't think anatomy and physiology. And so I loved it because I was, here's how everything works. All that biochemistry, all the clinical nutrition, all that, I tried to kind of merge that, and as we were talking about things, how the body works. And once you know exactly how every single thing works in the body, and you just reinforce it, then suddenly it became a lot more obvious how to fix people. The body's designed to work. What do we do to mess it up? And that really changed it. And then I went to the Harvard lifestyle medicine program, and that really reinforced it, and that solidified how I practiced from then on. And then suddenly, instead of seeing people just get better, I saw people who were not able to get better suddenly be able to fix, right? And we have a couple cases. There's 5 cases I want to talk about that were like miracle patients. And some of them, I'm excited when someone like just nobody can help me kind of patient comes in, because it's like, all right, let's do some research. Let's figure this thing out, right? So that led me to this kind of practice. And that's what I've been doing since. And I taught a 2.5-year postdoctoral diplomatic program out in Colorado for a couple years, and trying to re-educate and retrain physicians. And it was not always the most easy thing, because everybody's set in these dogmas, and so everybody has their philosophy, and they just proof text everything to fit that dogma. And I hate dogma. Hey, Carolyn. Glad you guys enjoyed. And hey, Valerie, I'm so glad you guys are joining. Please post questions. I see some of those. And I will answer all those questions too. And please share with your friends and family too, you guys. I really appreciate you guys being a part of this. So, in Chipotle chocolate almonds, oh yeah. Not sure about the dairy part, but oh yeah. So, I ended up with four postdoctoral diplomates. Was a board certification in integrated medicine. Harvard Medical School's Postgraduate Association, I'm a member of that, and the Physicians Committee for Responsible Medicine, a few other things. I then am the chairman of the board of directors for the American Board of Functional Medicine. I helped and helping right now to set up the board exams and change those things up. And I also was senior fellow of the American Academy of Functional Medicine. So basically, when other diplomates can't figure out stuff, and they have a patient they can't figure out, the senior fellows sit with them and try to figure out what they're missing from it. So, we want to talk about fixing the unfixable. Fixing the unfixable. Someone the other day, they asked, are you successful? And I was just like, well, I'm not successful at figuring out how to get rich, but I am kick-ass when it comes to fixing things. And we only have like a handful of patients now, maybe 1 or 2 to 3 or 4 sometimes, throughout the whole year, where it's like, oh man, they really challenge us. We got to work harder to fix that patient. We got to figure out what's missing. So what's interesting when I was lecturing, I think I used to actually do continuing education lectures across the country, but on one of the lectures, I think it was in Baltimore, there was a new study that came out from the New England Journal of Medicine, and it basically said that 52% of all diagnoses and treatment in the United States is wrong. It's incorrect. So, it was from the Washington School of Medicine, and they asked them why. Like, they're trying to figure out why over 50% of diagnoses and treatment is incorrect in the U.S. And what they said was, we're not trained to be primary care. We're not trained to fix things. We're not trained to really get at the root of problems. We are trained to be emergency physicians. It's how fast can you make that diagnosis and treatment and move on to the next. Triage kind of thing. And that's what it was in medical school too. It was just my clinical rounds. It was top three, top three, top three, top three. Well, if it's the fifth thing, it doesn't exist. And so that's great in the emergency room. We're number one for emergencies. But when it comes to the rest, we're like 37th to 100th, depending on what type of qualifications you're talking about with healthcare. We suck at healthcare. And that's just not a surprise that 52% of the diagnoses and treatments are incorrect. And a really good history and physical will get you a 97% accuracy, but you can't do that in 5 minutes. And that's why I tried to shorten my time to 30 minutes with patients. I cannot get through that. I spend an hour every time, no matter how simple things are. We spend an hour. We draw things out. I explain everything. The patient needs to know why and how it works. And I don't know if they sometimes don't care, but I still draw it out for them. Everything's a picture. Everything's a schematic for them. But it's important to know that we're not just winging this. Like there's a method to the madness in this. So when you look at trying to change that up, it's really about quality over quantity. You know, it's making sure the success is really of how well and how fast you get patients reversed. And when it comes to things like nutrition, I mean, most of you guys know this, that, only 6% of physicians have any kind of clinical nutrition. Yet all the 900 pharmaceuticals came from something that already occurred naturally. So that first blockbuster drug 100 years ago was aspirin, right? And that came from willow bark of a tree. Fast forward that to a few years ago, the newest breast cancer medicine, it came from the bark of a yew tree. We really only create medicines from things that we find that work in nature already. And all we do is take one molecule out and we synthesize that, patent it, and sell it back to you as a medication. But all medicine was natural medicine. A grandfather's grandfather who was a doctor was only prescribing natural medicine. And so that's how it was from the dawn of man to just recently for westernized medicine. And so the fact that all of it came from clinical nutrition, and yet none of that really exists anymore in practice, is an atrocity. It really is an atrocity. It is not helping the patient. Because the first thing you want to do is primum non nocere, which is first do no harm. Can we get the patient better without hurting the patient in the process? And you really can't when you're doing pharmaceuticals. Because there's nutrient depletions, there's interactions, and they end up with this myriad of, I think the average side effects are like 75 side effects for medication. And that's crazy. It's lunacy. So again, for people that want to do meds. But, it's not, if you want to be fixed, it's a different procedure. So let's talk about some cases. And let's see, Valerie said something here. My son did not get help with shoulders until he saw a physical therapist, PhD physical therapist who teaches at KU. Yeah, it's that same thing of like you can go to 10 different practitioners and yet one person really knows something else, and that's the person that can fix that problem. And that's not what patients expect. They expect they can just go to basically anybody and get the same kind of care. So, here's a few things. The goal in these patients is to, how do we fix them? How do we restore normal physiology without gimmicks and quick fixes? It's always without gimmicks and quick fixes. And in general, I'll let you know, there's 3 protocols that we kind of evolved to now. And the first one is figure out everything that's going on. So not addressing this one symptom they come in for, but really what is the total global symptomatology that's going on. And usually they'll come in for one thing, but there's 50 things that they've fallen apart. And they just get used to those things. Every day I have a headache, but everybody has headaches. Every day I poop every 3 days, but that's normal, right? I mean, and we end up in this place where we have these people that just become normalized with things that are completely abnormal. It's the same experiment they did they took this dog and they put it in a room. You had 2 floors in the room, and each one was electrified with switch A and switch B. If they electrified switch A, this dog would go to floor B. If they shut off floor A and they electrified floor B, the dog went to floor A. We always choose happiness when we think it's a choice, right? But what if they electrified both floors and there was no option anymore? Then the dog freaks out, but eventually becomes normalized to it. The body adapted to it. Suddenly this dog that's being shocked all the time can just eat and drink and sleep and live a fairly normal life while constantly being electrocuted. And that's the same way we end up, where we just kind of accept all these little things just because it's always there, it's chronic, everybody has it, and we just expect this is a normal part of life. That's where that weird thing, when I really switched up my protocol and really started just addressing lifestyle and how to stop causing the problem, I finally heard a patient say, I feel normal. And I was like, well, what the hell does that mean? Like, I never heard that before. And like all these chronic problems suddenly were gone. And they just felt normal for the first time. And then I heard it again and again and again. And it was amazing because suddenly we were fixing 20, 30 problems with just 3 basic protocols, which is figure out all the problems, but then do food as medicine, eat this, don't eat this, here's the clinical reason why, no gimmicks, and then dealing with chemicals. So here's all the chemicals you're eating, drinking, breathing, rubbing on your skin that are making you feel horrible. Stop doing that. And then how do we balance hormones without taking hormones? You don't want to do bioidentical because they downregulate your own production. You don't want to do synthetic because they downregulate your own production, and you're going to have a heart attack or stroke with that, right? And 30% risk of cancer. But that's okay, right? You want to just say, hey, my body has glands. Why the hell are they not working right? Make them work. That's really the goal. Make your body work like it's supposed to. So, like our example of using formaldehyde to sweeten food, or using 44 chemicals made from petroleum to make it taste like a strawberry, yeah, you should feel sick. And once you know these things, it's no longer this like, why do I feel like this? Why do my family have all these problems? It's, yeah, that's what should happen. When you go to the grocery store and you know this stuff, you look at their carts and you listen and hear about all their health problems, you're like, yeah, that's what should happen. You should feel like that. And your cheapest, easiest fix is to get in a plane and fly the hell to anywhere else. The other 202 free democratic societies around the world where they don't poison the people for profit. It becomes that simple. And if your plane went down like Lost, you'd walk around, find crap to eat. Not crap, but you'd find food to eat that fell on the floor of the jungle, and maybe eat an animal or 2 every now and then. Maybe some talkative survivor with you. And you'd be fine. Just like a horse, just like a chicken, just like a goat, and a shark. Nobody else has to figure out how to balance their hormones. Nobody has to figure out how to, have longevity. The rest of the world has this stuff figured out, but we don't, because we poison our population. And we exhaust ourselves. We're the number one for anxiety, the number one for depression. We cause these problems, and then we try to manage them because they're profitable. But someone like me who's backwards, like I don't know, I should be more interested in money, but I'm not. I like the aspect of knowing how to fix those things. So here's our first case. And I'm going to change some of the names. I'm going to change some of this the information just a little bit to protect their right to privacy, right? But we had this kid who had leukemia. And mom was very upset. Dad was very upset. The only thing the oncologists, I think, offered was a 50% chance that the kid might live or die if they did chemo. Which, by the way, if you don't know, statistically from the American Cancer Association, the survival rate is about 5% for pretty much any cancer. You'll see higher numbers, but that's because they manipulate the data just a little bit. I bought a book called Naked Statistics. I want to try to address those things at some point. But that's where you see, like, flu vaccine, like, oh, it's 87% effective. But then the news comes out and says, well, it's actually 5% effective. And it's just how they isolate and manipulate that data. So, parents usually aren't too excited about having the idea of their child dying, right? So, my first question then is, what causes leukemia? And if you search it, most of the time it's a big fat mystery. We just don't know. It's just this weird thing that suddenly all these kids are having leukemia. It's an epidemic now in the United States. They're getting younger and younger, and it's just a big fat mystery. But I love old books, so I have a bunch of old medical books. So the first thing I do is pulled out my anemia in practice. Because with leukemia, you have all these megablastic cells, like really big cells, all this kind of messed up stuff going on. So I looked at that. And in there, in 1929, it says benzene causes leukemia. Right? In 1929, we knew this. But you go to most doctors, it's a big mystery. We don't know what causes it. Just buy your chemo and hope for the best. So, the first thing that we want to do is figure out what causes the problem, and then we want to figure out how to fix that problem. So, I did my research, and a lot of these things in the beginning took a lot of research, right? But I figured out all the benzene chemicals. And lo and behold, that's like freaking nylon. A lot of the stuff people wear is benzene, and you're sweating this and you're getting benzene in there. You heat it up in the dryer and then put it on and you get benzene in there. So we don't use, hey Suzanne, how you doing? Howdy, howdy, howdy. So the chemicals that we drink, like benzoic acid and sodium benzoate, that causes leukemia. Things like artificial colors and flavors, those cause leukemia. And then if you look at the basic American diet for a child, it's all leukemia. In fact, processed meats, because of the nitrates we use, cause leukemia. And even when the study came out for the second or third time, it said kids who eat processed meats, I think it was like 12 times a month. And you're talking bologna and lunch meat and hot dogs, all these things, right? Almost all processed meats are going to cause leukemia in the U.S., right? The World Health Organization came out and said that American processed meat is now more likely to cause cancer than cigarette smoking. Nobody wants their kid to smoke, but they're feeding them lunch meat, right? And so, knowing that, or basically that came out, and then our church had a hot dog feed for the community. And so, I guess we need more people to pray for or something, right? So we cause leukemia, and then we try to pray it away, right? And I'm telling you, the first time, this all clicked, we were praying for someone that had cancer. Everybody brought their potluck in. It's all this horrible food, bunch of chemicals, processed nastiness, and we're all holding hands and we're praying for this person in our church for their cancer. And the pastor says, "Lord, bless this food to our bodies that it may nourish it." And right then my eyes popped open, and I was just like, "What the hell are you talking about? None of this food has anything to do with healing the body, nourishing it. We are causing cancer in our church and then trying to pray it away." That's lunacy. Or good business, I don't know, either way. So, so then with this boy, basically what we want to say is like, okay, well, here's all the sources of benzene that is going to mutate chromosome 12 in that very specific, I think it's Q34, and that causes leukemia, right? So what was really awesome is this kid actually came in with his genetic report. Nobody comes in with their genetic report. So he has his DNA all mapped out, and it shows all these different mutations. And so then I basically say, okay, as we go through this, what mutates these genes? What are we doing to cause this? What does he eat, drink, breathe, rub on his skin, wear? That's going to cause these specific mutations on this specific chromosome. And what's really messed up is it wasn't that hard to find. It really wasn't. It didn't. I did a lot of research, but it was not a mystery. And what's crazy is there's tons of research, but if your doctor doesn't do that research, then he doesn't know. So you do chemo while you eat hot dogs, while you wear nylon, while you wear spandex, while you use petroleum-based lotions on your skin that have benzene in there. Drinking benzene, eating benzene, wearing benzene. Those Glade air fresheners are benzene. And benzene is that flammable part of gasoline. So when you smell that stuff at the pump, that's what we make food and drinks and lotions and air fresheners out of. It's not a good idea. And we know it causes cancer all the way back to 1929. So the first thing that we want to do with this kid is stop causing the problem so his body can heal. Every single cell in your body is designed to fix about 10,000 genetic mutations a day. So, his body was being suppressed or overwhelmed to where he couldn't fix that mutation over and over. And so even with genetic reports, you'll see that only a percentage of those cells are even mutated, which means it's not even mutated every single cell in the body, but just enough is suppressed or overwhelmed by that chemical toxicity that it can't overcome that last little bit. So, Mom asked, can you help us? And I knew some about epigenetics, which is how do we actually change and modify genes to normalize DNA in people, right? How do we change that DNA? Because DNA is not your destiny. DNA is how tall you are, what your eye color is, the fact that my beard hair is probably a little bit redder than my actual hair. Those are not the things we're talking about. We're talking about those DNA that's mutated and how to fix that. And there was a girl with trisomy 21, Down syndrome, and MD News had this article about how she changed the nutrition, that changed the genetics that allowed her DNA polymerase to heal that DNA, and that girl was no longer Down syndrome. And that was freaking amazing to me. And she got her 60 minutes or 15 minutes of fame. It was on the news. She wrote a book. Her mom wrote a book. The girl went from completely Down syndrome to normal. Normal. Not that Downs aren't normal, but the appearance of everybody else. And that blew my mind. And that's where I said, yeah, we can fix these things, right? So I don't know anybody that's fixed genetics. I don't know any doctors that fix genetics. There's scientists that have fixed it in animal models. But I was going on vacation to Breckenridge, and I tried to search and find any kind of books I could find, and really couldn't find much. But I found a great one by Dr. Choi, and it was Nutrients and Epigenetics. And it is the most packed with research, the most boring reads you could ever have. And I sat there next to the cabin, watching the girls play in the creek, in the river. Big, beautiful mountains that I wasn't climbing. So I could spend my whole 2 weeks of vacation trying to create a genetic or epigenetic protocol that would be able to fix this kid. And holy crap, I figured it out. So, I wrote up the clinical protocol, I presented it to the patient, and we started. And this kid was getting his new DNA. So for, I think it's 5 years, he had his DNA checked, and it had the same mutation for 5 years, which is why leukemia was persistent. But we had 6 months before his new DNA. They say, well, can we fix it in that amount of time? And I say, I have no freaking clue. Nobody does this. I have nowhere to go for answers. But I know physiology. I know biochemistry. I know epigenetics. It works in animal models. Let's make it work for him and see. And so it was like, and in my head, everything works. You put oil, gas, antifreeze, charge battery. Everything works, right? So that's what we did. And 6 months later, he gets his new DNA report. 100% normal DNA. Parents are very excited. It's a miracle. That's what's supposed to happen. I wasn't quite excited for some reason. Because that's what's supposed to happen. That's what happens in my body and your body every single day. We constantly are fixing these mutations. And something as simple as if you take antibiotics, you kill off your gut bacteria. Your gut bacteria is what makes vitamins that are specific to regulating DNA. When you eat fruits and vegetables, especially things like garlic and brassicas and onions. Those literally make chemicals that go and create butyrate, and then that butyrate goes to your cells and it feeds a thing called DNA polymerase. And DNA polymerase goes through and looks at the histones and says, what does this next section of DNA look like? And if there's a mutation in that chromosome, at that gene, it fixes it. That's what our cells do. Each cell does 10,000 times a day. Millions of genetic repairs every single day. And as long as we're feeding that epigenetics, and we stop overwhelming the body with the very specific chemicals that cause that mutation, the body should heal. And it healed. And later, I had another patient, had multiple myeloma, same thing. Same exact thing. And so hopefully we'll get that published through KU, and that's why I've been invited to do research at KU Medical School and in conjunction with WSU, is to try to create epigenetic protocols to restore DNA that's mutated or polymorphisms within the nucleopeptides. So that's very exciting. And then I think the oncologist said, well, that's weird. And so then he said, I think it's a, anomaly or something. And he said, probably won't stay. So then the parents got discouraged. So the next year, they reran the labs. New genetic report. Still 100% normal DNA. And so it lasted. But because we changed the why he had it, not just manage it, not just do the epigenetics, but why does he have it, and change those chemicals. And was it hard? Hell yeah, it was hard. It was a lot of changes. It sucked for quite a while. But it's a lot better than having leukemia, right? So that's a miracle case, right? Like nobody does that. But that should be normal. It should be standard practice. I have a new patient down that's from Texas, or a client down in Texas, that she has leukemia, and same thing is the expectation is it's gone, and so they expect she gets her DNA done later this year, but the expectation was that we were trying to get it down to this level for her beta microglobulins as a marker for the progress of the leukemia, and it was way down here. So it was theoretically in remission numbers before it should have ever been there. So when we get that DNA report, hopefully that'll be patient number 3. All right, and then Crohn's. And what we'll do too is, so this is kind of an introduction, but over the next 4 weeks, what I want to do in September is I'm going to try to invite patients that want to come on and talk about their process. So miracle patients that nobody else could fix, they were just suffering. A lot of times they were just going to chop their bowels out or put them on chemotherapy. But I want you guys to talk to them too and kind of hear their story. And it's one thing for me to say it, but it's another thing to see another person. And that, again, just like I said before, that person becomes a beacon of hope. Like I tell you, that I'm part of that, like colitis and ulcerative colitis, Crohn's support group on Facebook. I hate it. All they do is surgery and drugs. That's all they do. Like no one on there is like, you know what? You don't have to be this way anymore. You can just not be ulcerative colitis. You can just not be Crohn's. You can just not have IBS. You don't have to get your bowels chopped out. Like it's such a crazy thing. And I think with those conditions, we're at probably 98, 99%. If patients do what they're supposed to do, it's insane how easy it is to fix those things. And so we have like, I don't know, dozens and dozens of Crohn's patients that are reversed. But one of my favorites is this little girl. She came from this little town, and she had Crohn's. And she had so bad that she was eventually starting to poop herself and have messes. And, then it's embarrassing at school. But just as a mess. Urgency was crazy. She couldn't make it to the bathroom anymore. And so it was very hard for her to go anywhere. It's hard for her to be at school. Again, the patients had heard from a friend of a friend of a friend who got their Crohn's reversed. And so they were willing to try it. And so she came in, her parents came in, and told me everything that's going on, and she's, I don't know, probably 8 years old or something like that, and that sucks because it's about the age of my children. Not all my children, I have 4 children, so I think it was my oldest was about that age. And it just sucked. It's heartbreaking. It's absolutely heartbreaking. But what we do is we say what causes that. And so usually it's an excess of histamine, but not from histamine foods, but from this something called molecular mimicry through T cell dysregulation. So Crohn's is autoimmune, and all autoimmune is T cell dysregulation with secondary molecular mimicry. And all that sounds like a bunch of big words, but I draw that out for patients all the time. There's talks that I've done about that. But basically, your T cells are suppressed to where they look at food antigens and they think it's a bacteria or virus, so they attack it. That produces histamines. That histamine then causes those kind of irritable bowel symptoms. And then if they turn to autoimmune through the secondary molecular mimic, they start attacking tissue every time you eat that food. So the goal is identify those foods and get rid of them. Long-term fix, stop causing T cell dysregulation. So with that girl, we did an IgG food sensitivity, like I posted it the first of the year. I posted mine, which it worked. I had that chronic cough and all this little things that were irritating me, and I finally retested my IgGs, food sensitivities, and then as you guys watched, I stopped coughing, right? All that hacking cough, it's all gone. So feel great. So with her, we did that test. And it came back pretty bad, right? Lots of wheat, lots of dairy, that's always given. But all these other foods I would never guess. So the goal is get rid of those foods. Stop eating those foods. Here's some changes you might want to make for substitutions. And then long term, the way that we cause T-cell dysregulation is through things like stress, which we're the #1 country for anxiety and depression. So we're doing it. We're suppressing our immune system, causing autoimmune, because we live a lifestyle that's incompatible with life and longevity. The other thing is sugar. We consume more sugar pretty much than any other country in the world, and we're the fattest. Nope, just kidding. Second fattest. Mexico's beating us now. We can't let that be. We got to be #1. So we'll get it back. We could do it, America. And we didn't even have a sugar storage disease problem called type 2 diabetes until 1950, roughly. And that's because of 150 pounds of added sugar to our diet. So we consume tons of sugar, we have lots of stress, and of course the chemicals that suppress the immune system are the same chemicals we spray on weeds and bugs to try to kill them, but we share the same physiology. So anything that we use to hurt the plants and hurt the bugs ends up messing us up in the process. So that girl then suddenly didn't have all the urgency, then the mucus disappeared, the blood disappeared, her bowels became normal, so she had normal daily, maybe twice a day, bowel movements that were formed, and it was like, oh, it's a miracle. And no, it's not. You just stop causing it, right? It's not that big of a deal, especially at this point. And then we worked on the longevity part. So we didn't have this girl come back the next year with just different things going on. And while they, if you went to pretty much any other doctor, just like we said before, you're only chronically suffering needlessly because what your current doctor doesn't know. And when every single patient that has Crohn's, ulcerative colitis, irritable bowel, their docs always say the same thing. It's not your food. It's not your food. It's not your food. It is your food, right? So I say the opposite, and that's because it works. So with this girl, it was amazing. So they came back, and they were like I think it was maybe 4 or 5 weeks later, right? I mean, this girl's been doing this for years suffering like this. And 6 weeks later, her mom was just like, said that the little girl was praying at her bed, and she's like, thank you, God, for Dr. Garrett, and thank you for normalizing my gut, and thank you for making my tummy better, and all this kind of stuff, right? Like, it was, to them, it truly was amazing. But what was really interesting, and this is kind of where you know things are really working well, is when they stop doing that extra thing that they do, which is like for her, they said when they ended up realizing that they were truly fixed was, she said, we went to the park and we didn't even look for a bathroom. And she said we always had to know where the bathroom is, how far can we get, is it to the bathroom, How far can we be away from the bathroom? What do we do if we can't make it to the bathroom? And she said it was the most amazing thing to not even think about where the bathroom is anymore. And so that's life-changing. That little girl became an inspiration to other kids who were told that they can't get better. Now, I'll tell you a couple things here. So, a couple of our patients, type 2 diabetes. I don't think we're going to make it through all these. Let's do the type 1, because that's really crazy. And then we might push the type 2 and the blue kid to the next time. We had a kid that sweats blue for 16 years, I think, or something like that. Now they don't. And all it took was a little bit of research and a natural medicine kind of treatment there. But let's talk about type 1. Type 1 is really interesting. I have been begging for a type 1 diabetic, right? That was compliant. Because I had a couple that were just like, yeah, let's do this. And it was like, you have to make these changes. No, I don't want to do that, right? So it's hard to get a kid to be compliant sometimes. So what's really interesting is we had one who was a former student of mine. Her son ended up getting diagnosed with type 1. So they go see the endocrinologist. The endocrinologist says, well, we can basically give him insulin, and that's about it. Good luck. So she contacted me and said, is there a way to fix it? I was like, hell yeah, there's a way to fix it, right? Type 1 is an autoimmune. Type 2 is dietary. So if it's autoimmune, all autoimmune is the same thing. It's T-cell dysregulation with double molecular mimicry. So we can fix this thing. Plus, there's all these other things that generate beta cells production from stem cells. So we can normalize those islets and longer hands in the beta cells of the pancreas. So we make more insulin, right? So we did all the testing. Okay, yeah, all the testing. Yeah, he's definitely a type 1 diabetic. It's really bad. He's taking insulin. Having all kinds of problems because of that too. So what we did was we created a protocol that said, here's the things that are causing it. They did that food sensitivity thing. So we looked at the histamines that are then in the autoimmune part. And so we can get rid of the autoimmune part of this, right? And usually for type 1, wheat's one of the biggest problems. Gluten's one of the biggest problems because it's not only a molecular mimic, but it's also cross-reactive. So even if it wasn't a mimic, even if it wasn't that typical thing, it can also be cross-reactive and still be the same problem. So with the type 1, we looked at stem cell therapy that's naturally through very specific herbs that are, again, research shows that they increase beta cells. So that's awesome. Well, let's regenerate some beta cells. We did the IgG, so we stopped causing the autoimmune part. And then we make radical changes to the diet because it's lifestyle medicine, and we say stop causing these problems. And guess what happened? He got worse. No, he got better. He got better, right? And all of a sudden, this kid that's type 1 no longer needed insulin. His blood sugars were normal without insulin. He was making insulin now. Is it a miracle? No. To the parents, maybe. But it's the normal. That's what should happen. Right? The stuff he was doing before, the stuff most people do for type 1, yeah, that's what should cause. That's what should be happening. Is we cause type 1 diabetes. But we can uncause it just as easily. And so what's really interesting is he maintained it. No, his blood sugar's perfect. They keep testing. Everything's great, right? So then they go back to the endocrinologist and say, look, we radically changed his diet. We're taking these things to stimulate beta cells, and he no longer needs insulin. And the endocrinologist, instead of saying, that's awesome, how can I learn how to do that? The endocrinologist said, well, you should feed them more carbs until they need the insulin. And so the solution that the endocrinologist came up with was cause the diabetes to get worse or to come back so you could use the insulin. And the mom's like, he doesn't need insulin because his blood sugars are perfectly normal. Well, you should really feed him more carbs so you can get him more insulin. Like, it's just like, it wasn't comprehending. But in the textbook of clinical and basic endocrinology, it says it's reversible. But rarely, well, it's been, 15 years? I've never had a type 1 compliant patient. So, I've had a type 1, 80 years old, blood sugar's all messed up, hypertension. Dude, we changed his media, and all those things improved. All that, your liver actually has this process called gluconeogenesis that makes sugar. So you can not eat the sugar, but diabetes can get worse because of the stress. Well, that was his major problem. So we actually changed his talk radio habit to NPR Science Friday, changed to the BBC instead of the news he watched, stop reading crime novels and all these horrible shows, and read things that are more constructive and interesting. And suddenly his stress changed, his blood sugar changed, and then all of a sudden he needed a lot less insulin. So that's type 1. That's type 1. And so when they say it's irreversible, it's not. It's absolutely not. All right. So next time we'll talk about type 2, and there's like endless cases just like Crohn's of that. But we had a patient that actually had unreadable A1C. I didn't even know that existed. But it only took, a matter of maybe 2 to 4 weeks for her to wake up with normal fasting blood sugar. And we'll talk about that case. And we'll talk about the kid who sweats blue, which was a really fascinating miracle case for us. And then on the show ad, right, there's a whole list. We're going to talk about all those. Everything from ADHD to leukemia to eczema. We have all these wonderful miracle patients that I want to talk to you guys about so that you have a better idea of really understanding what kind of functional lifestyle medicine is, and that people don't have to chronically suffer from these things. Okay, so we'll try to get a guest speaker as we kind of finalize here. Also, if there's a few places I'm going to start speaking at and doing some workshops at coming up this fall. But if you guys need a speaker for something, or you want to do a specific workshop if you're local here, let me know. So I think 1 week we did 3 or 4 kombucha workshops, which was really fun. I love that stuff. And then we'll try to have guests on some of the miracle patients that as guests so they can tell you their story. Please post your questions. Please share this with other people. And really, I thank you guys for attending. As we've been doing this show forever, I really appreciate that you guys are on board, involved, posting questions, and just like Dan posted here about natural pain things, I'll answer all those things today offline. So post all the things that you want to know about. And there's never a simple answer with me because it's like, okay, this is how physiology, everything's a chart. So I want you to know how things work so understand why we're making these changes, as opposed to saying this is bad, that's bad. Oh, and Shanna, thank you for attending. Captain ER Savior there. All right, please share this. And so the next 4 times, so please invite your friends and family that have problems that, a lot of times you can't get through them, but it's nice to kind of see other people, if they hear a stranger say something, suddenly it has some real credence to it. But, it's the next month we're going to talk about miracle cases. All right? Thank you guys. I really appreciate you guys attending and being part of this. All right. Have a good week. Let me know what your thoughts are, and we'll see each other next week. And you guys should Facebook Holly to try to get her back on after this summer, right? All right. Bye, guys.